Whoa, we're going back to a time when love and harmony ruled all, man. And all around you were het bees. I mean, hippies. No, wait, I do mean het bees. That's what I'm going to talk about today. Het bee. And it'll take place in our little hippie commune, man. So don't be square, man. Let's join hands and begin to explore the het bee hippies. As we're drawing out this scene, you might be thinking, where's the hepatitis hippo, since we are talking about a virus that causes hepatitis? Well, here it is, the Hep B Hippie Hippo van. We figured you may be a little hippoed out, and we didn't want it all blurring together, so we just tried to make the hippie van look a little like a hippo. Before I start talking about hepatitis and its symptoms, let's talk about some general characteristics. Hepatitis B is the most well-known virus of the hepadnavirus family, and hepadna is actually just short for hepatic DNA virus. So to remind you of the family name, we're going to draw in a hippie dome here with the sign reading HippiePad, which sounds a lot like hepadna. Can you dig it? Now, unlike Hep A and Hep C, Hep B is a DNA virus, which is why we have predominantly blues and other cool colors for our color palette. But don't worry, we'll still keep it psychedelic. It is an envelope virus, which is why you'll notice we have our hippies here wearing oversized, flowy hippie garb, like these cool cats sitting in a circle outside of the dome. Now I'm going to talk about two things that make hepatitis B pretty unique. First is where it replicates. Most DNA viruses replicate in the nucleus, but Hep B is slightly different in that it replicates both inside and outside of the nucleus. I know what you're thinking. Far out. Well, to illustrate this, let's go back to our hippie living quarters. It's dome-shaped, kind of like a nucleus, right? So notice how we have hippies outside the dome and one inside the dome poking his head out? Well, that'll remind you of both intranuclear and cytoplasmic replication. Another unique aspect of hepatitis B is that the genome is circular and partially double-stranded. So what was our single-stranded DNA virus? That's right, that was parvo. Remember the single strip of the runway? Anyway, Hep B is circular in structure and partially double-stranded, and becomes fully double-stranded during replication. So to illustrate this, look at our Kumbaya circle here in the back. It's a circle, and look, we're adding a second row of hippies standing around and holding hands. And notice how the outer layer is not complete, thus the circle is only partially double-stranded. It's also important to know the progression of replication. It goes from a partially double-stranded DNA to an intermediate single-stranded RNA, then back to a double progeny DNA. Wait, how does it do that? Is it magic? Well, kind of. It's actually due to the reverse transcriptase that hepatitis B carries, just like HIV does. But Hep B is not technically a retrovirus, it just has reverse transcriptase. Unlike the retroviruses, Hep B does not integrate into the host chromosome. Our symbol for reverse transcriptase is a spellbook, Reverso Transcriptum, which is being read by this free-spirited fortune teller. Okay, now how is Hep B transmitted? Well, it's not fecal-oral like hepatitis A. It is, however, pretty similar to hepatitis C, mainly through sex, sharing of blood products, sharing of needles, or vertical transmission. So, how are we going to remind you of sex and drugs in a sketch about hippies? Tough. Just kidding. We'll draw on this hippie lady holding a sign that says sex, drugs, and rock and roll. I don't think listening to rock and roll necessarily gives you hepatitis B, but I don't know, maybe it'll be a future case report. Now, let's give the mother a baby and let's have them don some cool red and white tie-dye shirts. This is to remind you of vertical transmission, and the psychedelic red spatter on the shirts is supposed to signify blood during childbirth. Remember that hepatitis B is a very large virus and does not really cross the placenta. It would only get transmitted if there were mixing of blood during delivery. It is, however, still considered a torch infection. Remember that O is for other. So we'll draw in some tiki torches over here around the mom. Also, remember that healthcare workers are at risk of getting hepatitis B from needle sticks, even though the transmission rate is pretty low. Okay, it's pretty obvious that hepatitis B virus is going to cause a hepatitis, inflammation of the liver, which may be accompanied with right upper quadrant pain, jaundice, etc. Like hepatitis C, some are going to be acute, which go away with time, and some are going to be chronic. However, compared to Hep C, Hep B is less likely to become a chronic infection. Only about 5 to 10% of adult cases will develop into chronic infection. Younger kids, however, are more likely to develop chronic infection, with newborns infected with Hep B virus having a 90 to 95% chance of developing a chronic infection. So let's have our mother and child here sharing a chocolate chip cookie that's shaped like a cirrhotic liver. The mother's so generous, she's only taking 10% of the chronic cookie, while our baby gets 90%. Aw, that's sad. There are also some extra hepatic manifestations of hepatitis B, which we'll illustrate with another free spirit, our hippie lady here who's beating. The most common disorders are a prodromal serum sickness type illness with rash and arthralgias, and people can also develop glomerular nephritis or even polyarteritis nodosa. First, I want you to notice the red beads on her string. Polyarteritis nodosa is a systemic vasculitis that affects medium to small arteries. The small aneurysms that form on the arteries are said to have a beads on a string appearance. How fitting. Now, for the prodrome of rash and arthralgias, let's cover her body with henna, which represents rash. This would be a purpuric rash with non-blanching dark macules. Additionally, as you can see, she's been kneeling for hours beating. So let's add some pain lines around her knees to exaggerate the arthralgia. Now, polyarteritis nodosa can affect the blood vessels leading to the kidney, which would manifest as a reduced GFR and hypertension. So let's add some bead boxes that are shaped like kidneys to remind you of the kidney damage caused by polyarteritis nodosa. But what goes in the other box? There are two other forms of renal diseases, unrelated to polyarteritis nodosa, that are also associated with hepatitis B, and these are membranous glomerulonephritis and membranoproliferative glomerulonephritis. We'll save the details about each for SketchyPath, but for now, if you recall from our previous videos, knots in a string, whether in a whip, a straw, or a telephone line, represent the glomerulus. So we're going to add two big knots to this string going into the other kidney box to remind you of the two types of nephropathies. Notice how the top knot has two strings associated with it to give it an extra thick glomerular basement membrane look, as this is what's seen in membranous glomerular nephropathy, a thickened glomerular membrane. Notice how the knot below has three strings associated with it to represent the deposits in the mesangium expanding into the glomerular basement membrane, causing a tram track appearance. And this is what's seen in membranoproliferative glomerular nephropathy. Way too much info for a microtest, definitely more path related, but we thought we'd include it just for funsies. Alright, the clinical picture of hepatitis B is a little too simple. More likely, you'll be asked to diagnose which stage of hepatitis the patient is in, and in order to do this, you'll need to interpret liver enzymes and serologies. This is an important point that you need to master in order to successfully answer questions about Hep B. As far as enzymes go, viral hepatitis causes an elevation in liver enzymes, and so does hepatitis from alcohol. So how do you tell the difference? In alcoholic hepatitis, AST is greater than ALT. In viral hepatitis, ALT is usually greater. So let's draw in a hippie playing with a beach volleyball labeled ALT to remind you of the rise in ALT seen in acute hepatitis B infection, and then the subsequent fall of the ALT levels after the symptomatic phase is over. It may not go back down to normal, but it definitely drops. Sitting next to him is a baby with a deflated ball. This represents the initial phase of a perinatally acquired HBV infection, where although there are high levels of HBV replication, serum ALT concentrations are often normal. Again, that's just for neonatal hepatitis. Now let's go back to our hippie hippo van to talk about serologies. Let's add some color to this van. I can almost see the flower power and smell it. The lines in this rainbow will represent the titer levels of the Hep B antigens and antibodies over the course of an acute infection and recovery. Wavy lines are hard to memorize, but we've come up with a way that should make it fairly easy. So let's spray a nice hippie motto on the side of the van. We're all one species. But notice how some of the letters are in colors and others aren't? We're going to focus on the colorful ones. The first one is S for Hep B surface antigen. This is the marker of active disease. It's the first one to be clinically measurable, and if it's positive, there's an active infection, either acute or chronic. The next colored letter is E for Hep B E antigen. This is the next antigen that appears and highly correlates with infectivity. If it's high, the person is usually highly infectious. Notice how both of these markers are antigens. There hasn't been enough time passed to create antibodies yet. I don't know about you, but when I think about hippie antigens, I think about a lot of buttons and stickers and other pieces of flair. So let's decorate the front of the bus around the first S and E. We also have the letters with these little spiky things poking off of them. They're meant to look like antigens hanging off of a virus. This is also the time frame where the patient has symptoms, which is why we've made the tire directly underneath this time period flat. It's symptomatic. Just keep one thing clear. It takes time for your body to mount an immune response to antigens, so it makes sense then that the first traces of the infection that could be detected would be antigens. Now comes the letter C, which is going to stand for the first detectable antibody marker, anti-Hep B C antibody, or anti-core antibody. Look how it's in the window of the van. This is to illustrate that anti-Hep B core is positive in the window period, or the period when the patient has started to develop anti-Hep B surface antibodies, so the antibodies have started to bind the Hep B surface antigens, and neither the antibodies or the antigens may be detectable. Hence, it's a window period and may give false reassurance that a person is not infected. However, if you remember to check anti-Hep B core antibodies, it will be positive and can tell you that they do have an infection. The next letter is E, the second E, which will stand for anti-Hep B E antibody. This is obviously the antibody to the Hep B E antigen, which means that there is low infectivity. It's not really a useful marker, but it has one academic value, and I'll go into that in a bit. So let's finish up our serologies with the second letter S, which is going to be the anti-Hep B surface antibody. Once this is developed in an infected person, the infection is over and the person has recovered. So if you are given a patient serology on a test and you saw any anti-Hep B surface antibodies, then the person no longer has an infection, either acute or chronic. This is also the value that's checked for any person who's been immunized. Recall that the Hep B immunizations are generally given at birth and are a series of 3 shots. An immunized person will not test positive for any of these serologies except for anti-Hep B surface. You'll see that we're making this blue curve wrap all the way around the syringe at the end to remind you that this is the serology associated with vaccination. So if both recovered people and immunized people have anti-Hep B surface antibodies, how do you tell them apart? With the presence of either anti-Hep B E or anti-core antibodies. Immunized people will be negative for both. Recovered people will be positive for at least core antibodies. Man, that was a ton of information. We're almost done. Let's keep going. Let's talk about the long-term sequelae of chronic Hep B infections. We're going to go back to the mysterious, free-spirited fortune teller who dabbles in magic books. Turns out she's also a tarot card reader. So let's carve her a magical tarot card table out of stone. Notice how it looks like a liver? Remember that in this sketchy world, when we portray a liver made out of something hard and scarred like a rock or coral, it represents cirrhosis. Now let's make her flipping over a card with a crab on it. Can you imagine what that represents? If you said liver cancer, I think you may have a psychic gift. Or you're just a sketchy genius. Hep B is a risk factor for hepatocellular carcinoma, and it must frequently be monitored. We're going to shift gears a little bit and talk about hepatitis D. It seems random, but hepatitis D actually cannot cause any disease without Hep B, so it's appropriate to include it in this video. So let's draw in a father hippie and 2 little hippie kids here on the side. Notice how the children are dressed in orange? This is because the children represent Hep D, which is an RNA virus. They're also dressed in flowy hippie garb because hepatitis D is also enveloped. It's actually specifically an RNA negative virus, so we'll give them necklaces with moons on them for RNA negative. Finally, it also has a circular genome of RNA, so we've added some circular orange hippie headbands to these kids. They actually require the Hep B surface antigen of the Hep B virus in order to cause infection. So let's add the hippie mom here attaching some pieces of hippie flair on the children's clothing to make them infectious. The two kids represent the two types of Hep D infection. The kid holding his dad's hand is being cooperative and represents co-infection, where both Hep B and Hep D are transmitted at the same time. The other hippie kid on his dad's shoulders in a superior position represents superinfection, where Hep D is transmitted after Hep B has caused infection. So superinfection has worse outcomes, as we can see by the father's expression. He's grimacing under the weight of the superinfection child on his shoulders. Okay, let's wrap up Hep B by talking about treatment. Most of the acute cases will clear up by themselves, but pregnant women and people who have progressed to chronic infections should get treated. Treatment will not eradicate the disease, it'll only minimize the damage by preventing replication. The mainstays of treatment are antivirals like lamivudine and other nucleotide reverse transcriptase inhibitors, as well as interferon therapy. Note that lamivudine and NRTIs are used in the treatment of HIV as well. So to illustrate this, we're going to draw on a huge peace banner next to our hippie van that reads, "Make peace, not war." Let's draw the most peaceful of all creatures, the lamb, to remind you of lamivudine. Under war, let's draw our warmongering, mace-wielding she-elf from our HIV sketch, who's stamping out a reverso transcriptum magic book. Notice that her mace looks like a nucleotide. She'll remind you that there are a few other nucleotide reverse transcriptase inhibitors besides lamivudine that you can consider using. If you recall from Hep C, interferon alpha was represented by an antenna twisted into an alpha shape, causing it to pick up some interference. Let's twist the antenna of the hippie van in the same way, because you can use interferon alpha to treat hepatitis B as well. Some of these drugs, besides interferon, can be given to pregnant women prior to delivery. And also, if the mother is Hep B positive, you must give the newborn baby immunoglobulin along with the Hep B vaccination for both active and passive immunity. So for our baby with neonatal hepatitis and the floppy beach ball, we'll cheer him up with these keys to the hippie van. Notice how the keys look like IgG antibodies? This is to remind you to give at-risk kids anti-Hep B immunoglobulins. Cheer up, little guy. Alright, that's about it for Hep B. There are a lot of unique things about the virus which make it a readily tested subject, so know the video well. Whoa, have I been talking this whole time? I don't even remember what we were talking about. Are you hungry? Do you have any Cheetos?